Hello, Dr. Sam Gaston here at North Texas Sport and Spine, continuing our common conditions series. Today we'll be talking about tennis elbow. So tennis elbow is also known as lateral epicondylitis, and it is usually seen with pain on the outside edge of the elbow. So right on that bump that you can feel out there, that is the lateral epicondyle. That's where all of the extensor muscles attach right on the outside of the elbow there. So anything that's going to extend the wrist, it's going to attach right there. So it's called tennis elbow, even though 95% of patients that get lateral epicondylitis don't play tennis. But usually the cause is going to be some sort of repetitive injury. So within tennis, it's a lot of backhands. It could be something turning a wrench, or any sort of motion where you're repetitively extending the wrist there. That could potentially cause tennis elbow. So main symptom you're going to get is usually a sharp pain right on the outside edge of that elbow there, and a lot of sensitivity if you were to push on it. Even now pushing on it, I can feel some sensitivity in my own elbow. With tennis elbow, there's a lot of different potential treatments. Injections tend to work pretty well when it is true short-term tendonitis or inflammation. But when it's a more chronic condition or a tendinopathy, as we would call it, there's really not that much inflammation there anymore, which is part of the problem. So it's gone from a short-term acute injury where there's inflammation, with a new injury to that tendon. But that usually will typically go away within 24 to 48 hours. But if you never stop doing that repetitive activity that causes the injury, then it will switch more into a tendinopathy. That becomes a long-term problem. And sometimes in cases of tennis elbow, you're looking at potentially up to 12 weeks before that starts to heal. And if you don't stop doing the thing that causes the problem, it's even then not going to heal. So some of the things that we do in office for tennis elbow is definitely a lot of soft tissue work. We're trying to stimulate blood flow to that area that no longer is getting it, because there is no more inflammation there to try to heal that damaged tendon. Dry needling works really well with this. So you want to perforate that tendon, try to get more blood flow there so that it can heal on its own. A lot of times you'll see bracing or strapping for tennis elbow. So you just take one of those straps and put it not on the spot that hurts, but maybe an inch or two down, more toward the hand, to try to create a new attachment site for those extensor muscles so that you stop pulling on that spot there. Rehab is very important when treating tennis elbow, and there's multiple different ways you can do that. A lot of times you'll want to do eccentric exercises, so where you start in the flex position and then with a weight work down like that. And there's been a lot of research lately about isometric exercise being very effective with tendon loading and rehab for tendon injuries. So isometric exercises are going to be ones where you don't actually change the length of the muscle. So you'd be in this position and then add resistance to the back of the hand, trying to force the wrist into flexion, but we're resisting against it. And that loading without changing the length of the muscle is good for strengthening that tendon there. So there's a lot of different things we can do to work on this in office. It is a condition that takes some time to heal, and just like I've said throughout this video, if you don't stop doing the thing that causes the problem is going to persist for a while there. So that's just a brief overview of tennis elbow and what we do with it in the clinic, and stay tuned for follow-up videos this month about some other conditions that we see in office.